So I'm Safala. I am a student at UTSC, and I'm doing an information video on Crohn's and IBS and UC. So I'm also sitting here with Christopher. He is a nursing student currently with
Pace IBD Clinic.
Pace IBD Clinic. And we're about to just have a conversation about Crohn's and UC and get into all that good stuff. So first question would be what organs are mostly affected?
So if we're talking about IBD, what we can do is try and break it down into Crohn's versus ulcerative colitis, because there is a bit of a difference. So with Crohn's, there is a particular saying it can affect anywhere from gum to bum. That's the expression. So what that means is you can actually get skip lesions. It doesn't need to be continuous, but those can run everywhere from the mouth, through the esophagus, through the stomach, into the small intestine, the large intestine, and then the rectum, anus area like that. So that's why they say gum to bum. And we typically think of it as just affecting the intestines, but in actual fact you can get inflamed lips anywhere along the tract. And with Crohn's, it's actually all layers of the digestive tract that are affected. So the lesions can be quite deep. It's not just the mucosa that's affected. And if we want to distinguish ulcerative colitis, the name colitis suggests that it's more about the colon. The colon and the rectum are the areas that are most affected by inflammation. It's usually a continuous lesion. It's not the skip lesions that you see with Crohn's. The rest of the digestive tract, other than the rectum and colon, is not really affected in ulcerative colitis as compared to Crohn's. And with ulcerative colitis, also the degree of inflammation varies. So you can have just one small area, and it might not be the whole layer of the digestive tract that's affected.
Okay, interesting. So if you had to list then the most prominent symptoms, what would they be?
So for Crohn's and ulcerative colitis, the symptoms will vary drastically from person to person, because your immune system is going to be affecting the response in your body a little bit differently than it would in somebody else. So with Crohn's, the symptoms present very differently from person to person, but in general, we can say that the symptoms that most sufferers worry about or affected with is rectal bleeding, blood and mucus in the stool, diarrhea, gas, abdominal pain, fatigue, weight loss, and increased infections, as well as it's not just going to present as diarrhea. You may also have constipation. So because it's affecting very often the small intestine. And with ulcerative colitis, some of the symptoms that people get are very similar. But because we're talking more about the colon area, rectal urgency can happen. Like there's a big problem with people that they really need to go when they need to go, and that's hard to control. But on top of that, they would often have the abdominal pain, bloody diarrhea, gas, fatigue, and weight loss that you would also see in Crohn's.
Ah, okay. Well, that's a lot of symptoms. How would you say you would manage these on like a daily basis?
In terms of managing flare-ups, flare-ups are caused by your immune system suddenly reacting and creating different conditions in your GI tract. You do have some control over them. So some things you could do is quitting smoking. Smoking is not something that's some people think that smoking actually relieves the symptoms. There's a bit of a myth about that going around. That might be the case. Sometimes nicotine may help ulcerative colitis, although of course we would never say that people should be consuming nicotine or smoking. So in general, good advice is to stop smoking. That's going to, usually it's going to cause you to want to go, so it's not going to help. Drinking alcohol, there's a lot of research that says that alcohol is not good for those conditions.
Okay.
So we can talk about other dietary modifications. Some people go out of their way to eliminate all dairy. And
Yeah.
this is where it
That's
gets
common.
personal. Yeah, it does. But because a lot of people have sensitivity to lactose,
Okay.
and some ethnic groups have more of that going on than others. So eliminating dairy is one way you can get rid of trigger foods in your diet. The other is to go low fat. Fat and spicy foods are harder for anybody to digest.
Right.
So that's going to cause an extra complication if you're already inflamed down there. Low fiber is important. And another big suggestion is to eat small meals, but eat those small meals more often to make things easier for the digestion.
Does spicy food inflame it more or just make it more complicated?
Well, some people may be much more tolerant to spicy foods if they
Yeah.
eat it each day, but
Okay.
in general, if your GI tract is inflamed,
Yeah.
maybe with like open lesions, you can imagine spicy foods are not going to make things easier. They're probably going to complicate things, as
Right.
well as greasy foods.
Right. Now you mentioned smoking is actually very bad with the now legal cannabis in Ontario. There's two different types of smokers, and they'll ask you, well, what do you mean when you say smoking? So there's not just two, there's also just people who smoke shisha as like tobacco. So what would those different kind of smokes, like cannabis, shisha, just tobacco, cigars versus a cigarette?
Well, as a nurse, we're taught to be very down on smoking, but I think all healthcare practitioners have had to update their knowledge and become more broad-minded about medical marijuana, and there's a couple of different ways. Marijuana can affect your immune system and also your GI tract, and some of those are not necessarily negative. You know what I mean? If you're suffering from weight loss, let's say, and you need an appetite stimulant, medical marijuana may help with that. But of course there are many side effects of using marijuana long term that you would have to be aware of, and you would probably want to discuss that with your specialist and your GP. So about smoking in general, tobacco contains a lot of nicotine, which is a stimulant, and that can make you want to go to the bathroom. So here, stimulants such as drinking a lot of coffee, that could exacerbate diarrhea, and that could make things worse in terms of not absorbing nutrients properly. And it can cause a lot of discomfort if you've got narrowing or strictures in the GI tract. So we want to look at ways of maybe decreasing the number of bowel movements, so it's not so much continuous work for your GI tract when it's already stressed out. So smoking tobacco probably is not the best fit for somebody with IBD.
For coffee, I've looked up and seen that coffee actually can increase bile. Now, for someone who has just gone through surgery, let's say, and had to remove a part of their intestines that actually creates more bile, what would you say? Would you say coffee is still it's not a good thing to have, or one coffee a day is okay?
Well, I think people look at coffee in a couple of different ways. First of all, there's the fact that it contains, according to some people, antioxidants. So maybe in moderation, it's not so bad. But moderation is the key word there, because it is a stimulant. We know that caffeine is a stimulant, and it's also quite acidic. So that could make things more uncomfortable for your GI tract.
Okay, good to know. So this is kind of an obvious question for people who have this disease, but for everyone else it isn't. It's quite a common question. Is there a cure, and what is it?
So that's a great question, and I want to keep with the theme of hope, because when we say there's no cure for something, and we're talking about a situation that's so difficult to live with, we want to offer people hope, but we also want to be realistic. And I think although I got to say there's no cure at the moment for Crohn's, we have to be complete in terms of letting you know that there are new things on the horizon. So let's start off with Crohn's. There is no cure for Crohn's actually officially right now. People do the best they can about trying to minimize flare-ups and trying to minimize their discomfort during flares. So symptom management with diet modification and lifestyle changes, we just talked about maybe not smoking. You might have to drink less cups of coffee per day when you've got a flare going on. Those are important things, and it's not easy to make lifestyle changes. But given that there's no cure, we have to look at how we can stop the number of flares. So one of the things is compliance with drugs. People need to remember that even though their symptoms are not noticeable to them right now, they've got a condition that's likely to come back. So they do need to continue taking all medications that their doctor has specified, even when they're not flaring. So if we talk about ulcerative colitis, there's the option of surgery to remove the part of the GI tract if it's resection somewhere else, or it's coming out in a stoma now rather than going all the way through. You remove that part of the tract that was getting inflamed. So that's an effective cure in a way. But then again, there's challenges to living with a stoma and a pouch.
Right.
But I also want to talk about new biologics that are now available, and one of those that we went to a presentation on was Xeljanz, or tofacitinib. It's a JAK inhibitor. There's lots of new medications that can inhibit how the cells in the GI tract respond to the inflammation. So there is new hope on the horizon.
Amazing. Well, that's good to hear. Oh yes, you had mentioned stimulants, so just to rewind a little bit, what about for patients, let's say, who have ADHD and they have to take Adderall or ADHD medication that is also a stimulant?
So absolutely, if you're talking about Ritalin and those types of medications that we're familiar with as stimulants, maybe they would have to look at modifying the amount or modifying when they take that during the day,
Right.
in terms of when their symptoms of IBD may be the worst, and also maybe discussing with their psychiatrist about getting a prescription for other types of meds that aren't stimulants for ADHD.
Good advice. Do you think that there's any side effects to treatments?
Well, absolutely. That's a big one in terms of managing your life the way you want to live on when you've been diagnosed with IBD and when there's a flare going on. So you may just take medications that are specific to when there's a flare, but also you may be taking some on a regular basis that they may affect you slightly differently than they affect other people. But talking about how everybody reacts a little bit differently and how they will get side effects a little bit differently, we should mention a couple of the commonly prescribed medications that are actually quite a challenge in terms of side effects. And if we talk about corticosteroids, prednisone, not the steroids that build your muscles up, but the ones that are more involved in breaking things down.
Right.
So those would be used to try and reduce the reaction of inflammation or the reaction to inflammation. And some of the problems that people are most worried about is moon face,
Okay.
where the face, you can see evidence of fluid retention in the face. Weight gain in general, which is a concern for people. Bruising and infections because the body's reacting a little bit differently in terms of inflammation. So those types of changes are disturbing to people because they change the way people look and how they feel as well. And then there's other anti-inflammatories like methotrexate. That interferes with DNA replication, but it also causes nausea and vomiting. And because it may affect DNA, a woman who's thinking of becoming pregnant would have to be counseled on maybe some type of family planning or birth control is best at that moment if she's on methotrexate for IBD. So they can cause problems in terms of how you want to live your life day to day. And you really do need to discuss with your doctor how you are reacting to your medication, because it varies so much.
Can you expand a little bit on a pregnant woman needing, because of like the DNA replication, there's being issues on there. Like what kind of issues?
Well, to be very simple about it, you've got another person growing inside of you. So if their DNA is replicating and they're going through growth cycles, which are going to have ramifications for, let's say, their brain development and other very important types of development later on in life, it's not just your DNA that's being affected. So methotrexate can cause spontaneous abortion as well. So some of these medications, although they may help you a lot when you're having a flare, they're not necessarily compatible with long-term situations. And because IBD, we're talking about often younger people who are diagnosed, we have to think carefully about how that would affect women that are trying to conceive at that point in their life.
Do you think that was a lot of things, so it would affect someone's mental health, definitely. Do you think these illnesses are related to depression and anxiety in any way?
I think, although those are psychological conditions that you just mentioned, and we're talking about an autoimmune disorder, they may not seem directly related. I think we have to, as nurses, consider a holistic approach, and probably even your specialist would use a holistic approach. They're concerned about you day to day, not just trying to reduce the inflammation. So I think what we have to say is, we all may have different predispositions to whether we're going to react to stress by some people becoming more anxious, some people by becoming more depressed. Any pre-existing predisposition you have, if you add these really serious stressors to your day-to-day life, just the stigma of bowel movements, the inconvenience, if you gotta go, whether you're at school, at work, or on the road, that kind of thing. All the stigma, that we as humans associate with going to the bathroom number 2. That can cause real alienation, that can cause real distress. And we're talking about younger people who, as nurses, we understand if this is primarily being diagnosed in people who are aged 18 to 30, they're at the prime of their life. They want to look really good. Not to say older people don't want to look good, but you're dating, and if we're talking about bowel movements and feeling sensitive about that and how that affects your self-esteem, if you have a predisposition to anxiety or depression, and now you've got a diagnosis that's going to affect your self-esteem, I think we have to look very carefully about all that, and you may need a referral to a therapist. And also, one of the most important things is support groups from peers, because if somebody is in that age group 18 to 30, even if they can only connect online, not in person, that makes a big difference. Talking to somebody who's one of your peers, who's been there, who knows the solutions, who can give you the tips, who can tell you about the apps, who can tell you about dating. Some people have a pouch, dating with a pouch. Is that a deal breaker in dating? Do you need to find somebody else with IBD?
Someone else with a pouch.
How are you going to bring that into your life and become strong, about that, resilient in terms of your self-esteem and your mental health? So support groups are really important. Crohn's and Colitis Canada has local chapters that are very active, because now we have the internet, young people can connect with each other online, and that's very important in IBD because of the emotional aspects the psychological aspects of living with a condition that can be stigmatizing. And IBD research centers and hospitals also have local groups that maybe meet once a month, maybe more often. And to find about those, you can go online or ask your specialist who's familiar with IBD, because especially for young people, that's important.
Yeah, it's perfect. So going through all of these things, it's definitely going on affecting your mental health. There's some specific symptoms such as gaining and losing weight, especially after bad flare-ups where let's say you'd have to get surgery again, or just in general you'll often have sporadic weight loss and gain. How would that affect a patient, and does it vary depending on their age?
Well, symptoms of IBD do continue when you're older, but in actual fact, beyond age 50 or so, it's just not having such an impact in people's lives. That's based on the fact that commonly people are more likely to be diagnosed between age 18 and 30. And when you're talking about young people, as we said, physical appearance is extremely important, because you're dating, you're relating to your peers in a different way that older people do. And you've had less of an opportunity to develop your self-esteem on, your whole person, not just your looks. So with young people, that's fair enough. Looks are very important at any age, but particularly at that age. And weight gain, I think we live in an era where everything's very visual on the internet. There's people are concerned with fat shaming, but what about when somebody starts losing a large amount of weight and they don't feel that they look healthy? That will impact maybe how they feel they're interacting with their peers, with people they might want to date, and it is a concern. So beyond just appearance, we have to look at malnutrition as well, because if you remove part of the GI tract, or even if it's just inflamed, you're not going to be absorbing nutrients the same way. So what you do for that is to look at ways of trying to get maximum nutrition with causing the least amount of discomfort to your GI system. And so as we said, you can do things like go on a low fiber diet, and in
What's up, y'all? It's Saf in the future editing this, and ooh, that scratch is attractive. Anyways, what's up, you guys? It's Saf in the future. We're in the future editing this, and I just had some additional notes I wanted to include here. If I look down, it's because I don't want to miss anything. So low residual diets are great at hitting the symptoms we experienced before surgery, but in my personal experience, it's not the greatest after surgery. In fact, for me, switching to a high residual diet was the exact thing that helped me go to a lifestyle where day-to-day tasks were made much easier for me. And the reason why switching from a low residual diet to a high residual diet after surgery may be beneficial for you is because your intestines are altered after surgery. The function of your intestine has literally been removed, that depending on what part of your intestine was taken. So we have to choose foods to help us work with our body and allow it to deal with this function that is now missing, and learn how to cope with fundamentally our new bodies. So low residual diets after surgery can cause symptoms such as diarrhea, constipation, urgency, nausea, and these are symptoms that I found happened to me way after surgery. And just speaking to friends of mine, they also noticed their symptoms were different, right? So I definitely would recommend that. It helps thicken the stool. It helps thicken the stool if you're dealing with that type of symptom after surgery. But I would highly recommend you work personally with a dietitian. If your hospital has dietitians, that's amazing. Personally, for me, my dietitian at the hospital kind of led me astray, so I was on a low residual diet way too long. And when I switched to a high residual diet, it really changed and altered my life. But that only happened when I worked with a specific IBD dietitian that thankfully I was able to get connected with through the hospital. But I did have to pay money out of my own pocket for that. So if it's available to you, I highly recommend you get a dietitian because she was great. She had put me on a Restoralac, Sicilian Pusk mixture, and it changed my life completely. So yeah, I just wanted to add that in there.
Generally, we want people to have as much fiber as possible because most people don't get enough. But to try and avoid irritants to the stomach, you could consume cooked fruit and vegetables instead of raw.
Okay.
Take the peels off and avoid oats and bran, that kind of thing. So again, it's about controlling the number of bowel movements, but still trying to get as much nutrition as possible.
Avoiding bran too, because bran has fiber.
It does, which in general is healthy.
Yeah.
But if your GI tract is compromised and things hurt, or it's a lot of work and you've got diarrhea, you have to think about things from a slightly different perspective. And you know, it's not just losing weight, but your hair and your skin and your nails, things that are important in terms of appearance. Those can be compromised too when you're not getting the best nutrition. So referral to a dietitian, you know, we've talked about a therapist. Referral to a dietitian might also be necessary because you can't just say to somebody, cut out dairy, cut out greasy foods, cut out spicy foods. We're all really different in terms of what irritates us, and that stays the same with IBD, but it's just much more challenging.
So not even just any dietitian, a dietitian that
knows about IBD.
Right.
Yeah. So we have some recipes on our website for foods that are low sugar, high calcium, like a special Italian cheesecake that's low sugar, high calcium. But that might not be everybody's challenge. That may be only suitable for specific people. Other people may be more interested in the fiber content and how much they can handle.
Right. Okay, perfect. Well, all of that amazing information that he has mentioned today will, like all of the apps and the support groups, things of that nature, will be in the links down below in the description box. And yeah, thank you.
You're welcome, Safala.
Coming. Yeah. And I actually came here, so thank you for doing this interview.
You're very welcome.
And so I was told by my specialist that if I get sick, if I even get a slight fever, I need to go to the hospital right away. And that makes me super anxious. It makes me not want to go out. It makes me want to like stay isolated in my house. But I mean, there are ways to deal with these things. I don't think that you can do it alone. I think that the biggest thing that has helped me, again, is my support group. And that is, it's not necessarily finding them outside. For me, it was finding the people around me who care about me, who love me, and who are there for me no matter what. Those are the people that will help you through all parts of this disease. And